Hi, I'm David Bank. I'm here at the Flea in Merida, Mexico with Javier Lozano from Clínicas de Azúcar,
Yep.
A network of diabetes clinics.
That's correct.
Tell us about it.
Well, thanks. Great to be here. So, Clínicas del Azúcar was founded 8 years ago, and I was in MIT doing innovation around healthcare and technologies for healthcare, and then, well, it was the first time that I started speaking with my mom about her diabetes, and just to realize how difficult it was for her, how she was struggling, just as every other patient. You have to go to so many places to manage your diabetes. So the idea was, can we do a one-stop shop, almost like a McDonald's for diabetes care? It's a convenient one-stop shop, low cost for the population in Mexico. And so right now we have 12 clinics. We are the largest private provider now of diabetes care and hypertension in Mexico. We were able to reduce the cost very significantly by putting these one-stop shops, creating like an assembly line and for patients, and patients pay a subscription fee. So it's a membership, an annual membership. And they have everything that is included. So we have doctors, nutritionists, psychologists. So we simplify how do you manage care, and we create access for millions of people in Mexico.
So diabetes is a huge problem in Mexico, as in other countries.
Yes, unfortunately, it's a catastrophe. But I think the real catastrophe is that because of the cost and the difficulty of care, it's a huge burden on the very low-income people, mainly.
And so you can both improve the health outcomes of the patients and also save some money to them and to the system, I guess, in general, right?
Yes. So with the membership and the one-stop shop, we were able to reduce more than 60% the cost of care, and because this is very automated, and there's a lot of technology behind how the clinic works, and also we were able to save more than 80% of the time, because in one visit they go through stations, and in 1 hour and a half is equal to 6 consultations. So think about transportation for these people, think about paying as a fee for service for each one of them. So in terms of time and cost, there is a huge reduction on that. And of course you have a convenient part as well that allows to have a much better medical outcomes and much better retention because of the easy and convenient part as well.
Unfortunately, it's a kind of a growth business, I guess, right? In terms of
well, yes, unfortunately, and it's just there are many factors about the way we eat, the lack of exercise, and the environment, pollution, and many factors that. And we say that we are a secondary prevention, because we help people with diabetes avoid complications like kidney failure or an amputation. And even in the states where we operate in Mexico, diabetes is the first cause of suicides. And there are many people that, because of the lack of care and the fear of complications, and they try and commit suicide. So unfortunately, diabetes is the first cause of death in Mexico. More than 80,000 people die every year because of the lack of care. It's the first cause of amputations, it's the first cause of blindness, it's the first cause of kidney failure, and in some states the first cause of suicides.
And so, as a business, you've raised money. You've got 12 clinics. What's the future?
Well, the future is we got a very good model, and of how we locate clinics and how we launch the clinic and how we operate clinics. And now the plan is just to continue scaling. So we are opening in 3 more cities, including Guadalajara. That's a big city in Mexico. And on top of that, we capture more than 3,000 variables per patient, all of that in one database, in an electronic health record. So we get into much now into data analytics, behavioral science, and especially for low-income people, we've been thinking how to increase engagement. And you don't want to put more cost on top of that, because it's already difficult for them to make payments. So we're looking at behavioral science, and now we create a diabetes nudge lab, and we are testing interventions to help low-income people make lifestyle changes and increase retention and improve medical outcomes in a very cost-efficient way. So the future is opening more clinics, and on the other side is getting very good at machine learning, data analytics, behavioral science, to improve medical outcomes and engagement of patients.
You mentioned the particular burden on low-income patients. Is there what is the business of serving? What are the issues in the business of serving low-income patients?
Well, the issue is that typically innovations in healthcare increases cost, because we are looking every time. Typically, we're looking at what is a better technology, and as we see in most of the developed countries, is that the cost of healthcare has just rise, and even probably among sectors is the highest increase in price. So this is what we're used to, is we've been accustomed to innovation, increase cost. The challenge is how we use innovation, as other industries like manufacturing, is how we use innovation to reduce cost, and that's not typically in healthcare. So the challenge is just changing the mindset that we should reduce cost, and innovation should reduce cost. So in terms of serving these low-income patients, and is finding innovations and having this mindset of every innovation should reduce cost so we can better serve the base of patients. I think that's the challenge and the disruption that we have to learn in the future of healthcare.
And if I may ask, how is your mother's diabetes?
How she's doing?
How's she doing?
She's doing very well.
Is she a patient?
Yeah, she is. She's always very mad at me because she's like the third patient on the registration, and she's always like, I should be the first one. But the good. Thanks for asking. And because, well, one was we were able to help her and improve, and that was to me one of the excitement. No? And definitely there are many people like my mother out there. But then we start a call center. And we wanted to get more empathetic with the patients. So we got this idea of typically patients lie to doctors and nurses. Like if you ask them, are you doing your diet? Are you taking medication? Most people will say, yes, of course. And so we start a center of patients that call other patients, because you have more sincere conversations. So she helped me to launch that. So now she's part of the company. She works at the company. And she leads the center of calling other patients. How are you feeling? Have you told the doctor? And this, and identifying what's the concerns and what are the trends of the patient. So, of course, every Sunday we have lunch together, and at the beginning, every meal will be about, I talked to this patient, and I have to tell her, like, oh, Mom, we should not talk about work on Sundays.
And I'm sure it's a very healthy lunch you have, right?
Exactly. So she's very excited, and to me it was the second transformation of my mom. First, being in control, and second, being able to help and serve other patients.
That's a beautiful story. Well, thank you for joining us.
Thank you.